The latest and most contagious yet coronavirus variant, the BA.2 version of Omicron, has officially taken over as the dominant strain in the U.S. Across much of the nation and here in Massachusetts, case numbers are once again on the rise, but at the same time, the CDC has lifted its travel advisory for cruise ships. Mask mandates on planes and other public transit are set to expire on the 18th of April, and nearly half the states are suing for that to happen even earlier. And the president is telling us we've turned a corner.
We're now in a new moment in this pandemic. Does not mean that COVID-19 is over. It means that COVID-19 no longer controls our lives.
And yet in the same breath, Biden is asking for more emergency COVID funding from Congress because although the FDA and CDC approved a second booster for those over age 50 this week, the government has no money left to buy more vaccines than it has on hand now, nor any more therapeutics for those who get sick.
We need to secure additional supply now. We can't wait as we find ourselves in the midst of another surge to act. It'll be too late.
And with parts of Europe in another surge now, some experts say we're likely to follow. So where exactly are we? I'm joined by Dr. Sabrina Assoumou, Assistant Professor of Medicine at Boston University School of Medicine and an infectious disease attending physician at Boston Medical Center, and Dr. Paul Sachs, Clinical Director of Brigham and Women's Infectious Disease Division. Doctors, it's good to see you again both. Thanks for being here.
Thank you.
Thanks for inviting us.
Dr. Assoumou, if I can start with you, masks are off, vaccine mandates disappearing, people congregating in large numbers at lots of places. Do the objective facts justify that behavior change?
Well, thank you for having me on today. You know, one thing that we learned early on is that we have to have a very robust surveillance system. We have to monitor what's going on with the wastewater. We have to monitor what's going on with case counts and what's going on with hospitalizations. And right now we have early indicators that, wastewater inflammation that is going up. If you look at the test positivity rate, even in Massachusetts, we're creeping up slowly. So this is definitely a time when we need to use some caution and think about, what are the tools that we need to be using right now to prevent another surge.
Well, Dr. Sachs, it seems to me the wastewater numbers are up slightly. There are spikes in other parts of the world, and I know this will not shock you, I am not an infectious disease expert, but what happens elsewhere often happens here. It seems to me we're not taking precautions. People have pretty much said, that's behind us, summer's coming, let's move on. That's a mistake, isn't it, or is it?
Well, I would say I'm going to come at it from two areas. On the one hand, what people are responding to is a lower per case severity with each COVID case. I mean, everybody knows lots of people who got COVID in December, January, and most of the cases were mild, partially due to immunity to it and partially due to vaccines because people had been infected before, people got vaccinated. On the other hand, there were so many cases that our hospitals were still quite overwhelmed with COVID-19. But that first impression, which is that COVID-19 is not as severe as it used to be on a per case basis, is accurate. And I think that explains a lot of why people are moving on. Nonetheless, we have to be very concerned about what we're seeing in Western Europe, in particular in the United Kingdom.
Well, it seems to me, though, I'll press this point for just another second, Dr. Sachs. It also seems that we're not hearing much of that from the same people we used to hear from every day about it's not over. There's almost like a laissez-faire attitude. Congress is doing nothing on future funding as if this never happened and has gone away. When they approved the second booster, which we'll talk about in a minute or two, it wasn't even recommended. You are eligible for it now if you're over 50, and which to me sounds like you want to do it, do it. If you don't want to do it, don't do it. That kind of attitude is not very helpful for those of us who are mere mortals, Dr. Sachs.
Well, if I could articulate the strongest message I can on the evidence on boosters, it's that third dose. And there's still a huge proportion of adults who have not received that third dose. So please, if you have not gotten it, go out and get it. These vaccines were designed with 2 quick doses just to get them out there. But to get maximum effectiveness, we really need that third dose. As for the fourth dose, I would strongly recommend it for people who are medically vulnerable and for people who are elderly, but it's not something that I feel as strongly about as the third one.
Yeah, but most of us want to be told what to do. You know, Dr. Assoumou, if we can start on the first dose to follow up on what Dr. Sachs said, we'll put up some numbers for people. We're doing a little better in Massachusetts if you look at the third column of what we put up here in terms of that first booster. The percentage overall for those eligible in Massachusetts is 55%. Nationally, it's only 45%. Again, the first booster. How worrisome is that, Dr. Assoumou?
You know, I would be worried because what we've learned from our first Omicron wave is that, you know, to really be protected from Omicron, you need that booster to get you to that higher level of protection. So I think that unfortunately what I'm seeing is, you know, the message is not getting out there. I agree with Dr. Sachs that if you haven't been boosted yet, please go ahead and get boosted. It's not an extra dose, it's actually a dose that you actually require to get the level of protection that's needed in the community to protect you from the currently circulating variant.
Well, Dr. Assoumou, staying with you, then would it have been better? I mean, there are many arguments against the approval by the FDA and the CDC of this second booster. To some people like you, and I agree with you, it was a 3-shot regimen and this is the first booster, but it wasn't presented that way to the American people. Some say it's distracting attention away from the need to get certain parts of the population first dosed, second dosed, boosted. So let's respond to that first, Dr. Assoumou. Is it for people like you who see patients, is it directing too much attention away from what our primary goal should be before we worry about second boosters?
No, I think you do make a point, but let me give to the defense of the public health community that I'm part of. You know, we're in a pandemic. We're learning as we go. When we initially saw these data that our vaccine was 95% effective, you know, we really thought that, you know, all you needed was just to get fully vaccinated and you'd be fine. But we're learning more. We're learning about waning immunity, and that is why the message is changing. And if I can get out a couple of points today,
Sure.
One of them is that booster is really critical. So if you haven't been boosted yet, and you're wondering whether or not you should have it, it's actually part of the series to be protected. Now, the second message is, you know, what to do about that fourth booster. Do I need it? Do I not need it? The best data that we have for that fourth booster are for people who are 60 and over. And the FDA and the CDC are saying that, you know, if you're 50 and you have an underlying condition that puts you at higher risk for severe disease, then you should consider it. And I think that's actually the right move. But the message is if you haven't done so yet, you need that booster to get the high level of protection that you would need against
the first booster. Dr. Sachs, let's stay on the second booster for just a minute. I don't want to give people a headache, but it seems to me there are two other problems. We got a number, when I mentioned that it was approved yesterday on the radio, we got flooded with emails. And some people over 50 said they were concerned because, to use the word that was just used by Dr. Assoumou, the waning effectiveness. Well, wait a second. If Dr. Fauci says there may be a surge in the fall, and I get it now, its effectiveness will have waned by then. So I've gotten the first booster, but I probably shouldn't get the second booster until later in the year. What do you say to that patient?
Well, what I'm advising my patients is that if they have medical vulnerabilities, they should get their fourth dose, their second booster now. And if they don't have medical vulnerabilities, then it's a shared decision-making process. And we already have vaccines that are like that are FDA approved, and we have a discussion about the pros and cons. And one of the downsides would potentially include needing to get another shot in the fall. But for people who are medically vulnerable, I don't have any problem recommending this fourth dose right now.
Well, speaking of what you tell patients, Dr. Sachs, when your patient reads in the New York Times or the Boston Globe that the federal government has decided they're not going to appropriate any money to pay for this, and they say, I can't afford it, what do you say to that client, that patient?
Well, right now, vaccines are still covered in Massachusetts.
Second booster? We
have not heard of any people being turned away from their second shot, at least not anecdotally so far, which this is just the first week.
Dr. Assoumou, I want to go to the other end of life, young people, and put up the numbers again. The vaccination numbers for 6 to 11-year-olds, which are the youngest approved, you can see that are pretty pitiful. How worrisome is that, particularly in light of the fact that we're reading, I guess, out of Europe, that the effect on that age group, and maybe even a little older, has led to 3 times the number of hospitalizations as earlier, meaning it's having a profound effect, comparatively speaking, on young people. How worrisome is that low number?
Yeah, no, I would tell you, actually, let me share a personal story. I have a 5-year-old, and as soon as those vaccines were available, I was one of the first ones to get her vaccinated because I'd seen the data. I knew the vaccine was safe and effective. And we've had more data that went on to show us that these vaccines are very helpful to protect against hospitalization. And so for any parent who has any hesitation, I would recommend that they should get their children vaccinated. What we're suffering from, I think, is initially, the message was children don't get sick from COVID. Children do fine. Yeah. But what we're discovering is that children do get COVID. They could get hospitalized from COVID and they could die from COVID. So we need to really get that message out there that yes, children are less likely to get severe disease, but they can get sick, and that these vaccines are important and they're an important public health measure for the whole community. And
Dr. Sachs, what's your projection as to when the youngest of kids is going to be able to get a vaccine, assuming their parents want them to?
Well, both Moderna has filed, and the data on the third dose for the Pfizer vaccine has already been, is currently being analyzed. So I would say probably in the next several months, we'll get some information about for the youngest children.
Dr. Sachs, can I stay with you for a minute? I wasn't even aware that an additional study was being done on ivermectin, which most of my friends call Jovermectin, after Joe Rogan, the snake oil salesman. And you said something like, it'd be a waste of resources to study anything further that's unpromising. Why did we study it? It has always been unpromising, and the results showing it isn't effective aren't going to persuade the people who are in the Rogan camp anyway. So why did we spend even a nickel on this?
So it's a good question. And at this point, the studies had already been started up. And we really wanted to have good evidence from good studies from really honest researchers who didn't present fraudulent data. And with this latest study that appeared in the New England Journal of Medicine, we have that. And there is an additional study that the NIH is funding that should be coming to data analysis soon. And that, I hope, will close the book on ivermectin. You're right that there will always be people who believe in it just because they believed in hydroxychloroquine, and they're going to believe in this. But I can tell you that from me, the data are pretty clear. It doesn't work.
Those people stocked up on bleach too. Doctors, before you go, Dr. Assoumou first, I referenced the fact that there is a pathetic logjam in the pathetic United States Congress over further funding from COVID, almost as if this hadn't happened. It's almost like no lessons were learned in this partisan divide here. How dangerous is it for America, for Massachusetts, for all of America, if this logjam is not broken in Congress? First you, Dr. Assoumou.
I understand we're all tired. We want to move on. And we're actually in a better place if you think about Massachusetts and the numbers that we're doing. But we may say that we're done with COVID, but COVID is not done with us. And I really hope that we get the funding that we need so that we can actually get enough of all the tools that we know work: vaccines, testing, high quality masking, and especially those medications in the outpatient, and ways that we can also improve ventilation and filtration. So we're in a different place than we were in 2020. We know what works, and we really need the funding to be able to implement all those measures.
How about it, Dr. Sachs?
Well, there's a lot of pandemic amnesia. People feel like, I'm done with this, time to move on. I just want to remind people we still have hundreds of people dying a day of COVID-19 in the United States, something we would never tolerate with any other infection before this. And while we have that going on, we really have to prepare. What's happening right now in the United Kingdom is they have a substantial increase in hospitalizations. It's much better to be prepared for that than try to react to it retrospectively.
Hope somebody's listening. Dr. Sachs, Dr. Assoumou, it's wonderful to see you as always. Thanks for sharing your expertise. I appreciate it.
Thanks, Jim.